Every week on Tonic, we find an expert to answer some of your questions. And to ask a question, by the way, you email us at questions@tonictv.com.au. Anyway, this week's question is, I'm being treated for high cholesterol. My GP seems happy with the levels, but I'm wondering whether I should get them much lower. How low should I go? Well, we went to somebody who's researched just that question, Professor Tony Keech at the George Institute in Sydney.
Well, the message for consumers is that your cholesterol needs to be as low as it possibly can be. For many people, of course, diet alone will be enough to do that. But if you're at particular risk in relation to cholesterol, such as people who've already had a heart attack or stroke, for example, or even people with diabetes or kidney disease, it is important to get the cholesterol down very low. And that means that the bad cholesterol, what we call the LDL cholesterol level, needs to be reduced to below 2 ideally. If the LDL cholesterol level can be lowered to 2 or less, then we believe that the process of ongoing furring up of the arteries with cholesterol deposits will slow or stop even in some patients. And in some cases, individual narrowings in the arteries might even reverse.
What harms are associated with lowering the cholesterol that low, if any?
Well, we've really found very little. Certainly there's no signal of any increase in cancer, which has been a major concern with these sorts of drugs. And secondly, there hasn't been any major problem with muscle inflammation, which can occur with these drugs. And many people can get muscle aches and pains taking these sorts of medicines. The important thing is see your doctor if you do, but unless they're very serious, don't stop the pills.
So go as low as you can, but just be aware that the higher the dose of medication you use, the more likely you are to experience side effects. It's not a reason for not trying, but just keep an eye on things with your general practitioner and pharmacist.